to send us, or any questions that you might have, our text number is 077 488 55055. I'll repeat the number again, 077 488 55055. Or you can call in on the studio number, which is 0116 482 2086. 0116 482 2086. So we're going to be talking about lots of different subjects. Can I introduce my first guest, who's Professor Ivan Browne? Ivan Browne is a Director of Public Health for Leicester City, born and bred in Leicester, and has worked here all his life. Good evening, Ivan. Thank you very much for joining us today.
Good evening. Thank you so much for having me.
First of all, can I congratulate you on your honorary degree from Loughborough University, recently obtained by you, and congratulations on that.
Yeah, thanks. That was a huge surprise, but it was wonderful that my home area recognised the work that we've all been doing in terms of trying to meet this crisis around COVID.
You're a Leicester lad. You've grown up in Leicester, born and bred. I know you went to Leicester College, and you're a real role model for lots of young people out there, because you've started right at the bottom and gone up to the top of the ladder.
Yeah, I mean it's been great. The strange thing for me, I guess, is that as you said, Leicester born and bred. Most of the people that are around, I already know them, and even I know that our paths crossed a number of times before I was doing this role. I remember you cross-examining me actually before Health Watch at do you remember the Quaker Meeting Hall
Yes.
on Queen's Road?
Yes.
I remember you giving me a hard time, so you got to be kinder to me this time.
I thought during Ramadan I'm always kind to everybody. It's a time of giving. So now, COVID has hit Leicester really, really hard. You've been involved right at the top with this whole COVID pandemic, and Leicester's been on lockdown continuously almost since March of last year. How challenging is it, and why has it been so stubborn to get the numbers down in Leicester?
Well, I mean, it has been hugely challenging. I mean, we've got a number of people on here, but also, lots of people who've just gone through this experience, and we know that one of the big myths that came with COVID. Now, people remember this, where they called COVID the Great Leveller. The idea that we're all going to be affected. Now, anybody who works in a healthcare setting or has any understanding of how communities function know that whenever you get a situation where people are at health risk, those that are most vulnerable, those that are least able, will be the ones that get hit the hardest. And we know that, for example, in terms of things like, economic regeneration, functioning of households, basically areas that are more complex and have challenges, get affected more by COVID. And we've seen this not just in Leicester. We see, you go to Luton, you go to Blackburn, you go to areas of London, parts of the West Midlands. We're all fighting the same battle. The issue for Leicester, of course, had been that because this was a whole novel thing, during the summer, when our figures went up, and it's really funny, when you think about the figure of 135 per 100,000, which is at the point that we got locked down. One of my colleagues is on here, Samir, will tell you all of the data. And over the Christmas period, there were areas of the country that were 1,500 per 100,000. But we were learning as we went along. So we know that we're going to be in that challenging environment because of the nature of our city, the way it's structured, both the geography, both the demographics, and that's why we have to work really hard to make sure that we are always on top of COVID. The thing with us in the city is we just have to keep on it consistently. There is no wriggle room for us as a compact multicultural city. We don't have the luxuries that maybe other more countrified areas may have.
No, exactly. I'm going to bring Dr. Samia Latif in as well. She's a consultant in public health for the East Midlands area. Good evening, Samia. Thank you very much for joining us on Radio Ramadan.
Pleasure, Zuffar. Pleasure to be here.
Did you want to add something to those comments? Because, COVID has been here, and it's, as Ivan was talking about, it was supposed to be a great leveler, but it's actually turned out to be the opposite. The people who are struggling the most are hit the most hardest.
Yeah, I guess very early on last summer, we saw the COVID disparities review that Public Health England produced. And what that showed was that people who belong to ethnic minorities tend to be more adversely affected by COVID. And unfortunately, if you live in a multicultural area like Leicester, you will see that impact hit you. I think the people of Leicester have been very resilient. I do remember reading a press covering statement somewhere about the city that has been most under lockdown. And Ivan, I think we'll agree that out of all of the UK, we have been in lockdown. And I think what's happening now is COVID fatigue is setting in. We're seeing that across the country. But what is very important for our people and our residents in Leicester and Leicestershire to understand is that we cannot lower our guard. There is a lot still to be done in the city. I know we're in Ramadan where the daytime is usually quiet, but oh my God, you go outside after iftar. I've only been once, but my kids have been a couple of times. It is absolutely packed. And people are now beginning to think, it's no longer an issue, or they're just too tired. And I can't reiterate enough the importance of still maintaining that physical distance, wearing your masks when you're outside and washing your hands, ventilating the rooms you're in. And the one thing I want to say about masks, it's been bugging me and I've been saying it everywhere, wearing a mask does not mean wearing it under your nose. That is not right. It needs to cover your nose, cover your mouth. And remember, you're doing it not just to protect yourself, you're doing it to protect your loved ones and your family members. So that's just one key message, Zuffar, that I'd like to take everyone to.
Thank you very much. It's really, really important that everybody carries on, keeps their guard up. Leicester City were the Premier League champions. We don't want Leicester City to be the lockdown champions. And, we need to get rid of that title. And the way to do it is actually carry on. And it's really important, the point that you make about the mask being under your nose. It needs to be over your nose. There is no protection with that. And actually, it's more important that we keep Leicester out of the league and make sure that everybody adheres to the rules, particularly the mask and the social distancing or the space element of it. It really is crucial. Ivan, did you want to come in on that comment as well?
Yeah, absolutely. I mean, Dr. Latif spoke about underneath the nose, equally underneath your chin. That's even worse. There are just some real strange practices. And we have, there are places that have worked so hard, communities that have worked so hard to try to bring this under control. Now, we have been sitting across there in the top 10, the top 5, the top 20, sort of since February time. We are now outside of that area. We have seen some considerable drop, particularly over the last week. Where we are dropping down in that figure and becoming more in line with the national. But of course, I am fearful because we've got the FA Cup final coming up. We have many things that will draw people together. And as Dr. Latif said, this virus is just looking for opportunities. It will, as long as you're together, it will take any opportunity it can. And I'm sure at some point, we're going to talk about sort of some of the new challenges that we face in relation to variants, etc. That mean that we, as we said, we have to keep our guard up. It would be an absolute disaster for us to put our guard down at this time.
And we're going to bring in Dr. Mohammed Tufail here. He's a respiratory consultant at Glenfield Hospital, deals with the COVID cases, has been non-stop busy for the last 12 months on his wards at the Glenfield Hospital. Dr. Tufail, how many patients from ethnic minority backgrounds have you been dealing with, and what has it been like? How tough has it really been for those patients who are coming in with COVID?
Thank you, Zuffar. As you said, it has been a challenging time for us, and I'm very much thankful to Ivan and Samia from a public health point of view, really, who have kept to some extent patients not coming to us. Basically, we don't want hospital full of COVID patients. And it is important that obviously prevention is better than cure. And to start with, there was no cure. We did not know which medicines work, which did not. And Leicester as a whole and Leicestershire should feel proud that we have been the biggest contributor to the research when it comes to finding the new medicines to treat COVID. Especially, we have been part of a recovery trial, which discovered quite a few useful and life-saving medicines. Obviously, having a patient with COVID in the hospital is never nice. And from ethnic minorities, I have seen even families, multiple members of the families being admitted at the same time. And that's not either nice. And then communication becomes an issue. You can't visit due to these communicable diseases, and visiting was restricted. So it has been quite a tough time for us. But at the same time, I should thank our community, our public health colleagues that I'm seeing light at the end of the tunnel. And we should feel proud of NHS, as we can see in other parts of the world, people struggling to access the healthcare. But I will say NHS has been a blessing for us in these difficult times. And thank you for all of your help.
I mean, the NHS has done a fantastic job, and that's testament to all the the people on this call, Zoom call, at this moment in time, because all of you have played a part. The NHS, all part of this great family of the NHS, which has saved so many people's lives. It could have been a lot worse than what it currently is, and has been. Dr. Tufail, there must have been moments where you felt disheartened and sad during this 12 months in the hospitals, where you've seen so many people pass away, sadly, in front of your eyes. How painful has that been for you?
Absolutely. As you know, it is a global problem, and you always think about your own families as well. And it is not a problem of one person. It is a problem of whole world, a whole community, and we have to look after each other. Having people, especially during the first wave, having patients and where you can't do much. And as a doctor, your instinct is that you want to do something. You want to cure the patient. You want to see patients recovering well and going home to join their family members. And that was very painful thing when you feel helpless. But as I said before, we have learned a lot from our experience, and especially UK has been at the forefront of finding these new medicines, which are proved medicines for COVID. So overall, I know it has been difficult, it has been tiring and challenging, but at the same time, it is a moment of pride for us as well. And I think UK is the country which has contributed most to the research, and it is the setup of NHS which has helped us to recruit thousands of patients to our trials to find new medicines and provide state-of-the-art care. So yes, it has been a difficult time, but at the same time, lots of learning. And I always felt that we were blessed to serve our community, and we did that.
Thank you very much. And also, please take the thanks back to the teams that work at the Glenville Hospital and the rest of the hospitals from the listeners of Radio Ramadan for all their hard work and their dedication they've done to look after patients across the board over these last 12 months, and what they do every day, really. They do a fantastic job. I just wanted to bring in Ivan again here now. How is the vaccination going ahead, and how effective is the vaccinations at the moment in time?
I mean, this has been the good news story, and everything that we were doing prior to that, all of the work that we're doing, the social distancing, the lockdowns, all of the advice which is still relevant. We were just trying to minimize until we had a solution, until we had a pharmacological intervention that we could make, and the vaccine program has, and I would speak particularly for Leicester actually, the vaccine program that we've seen in Leicester has been phenomenal. I mean, it has been such a game changer for us. I've talked again. I'd go back to our
Ivan,
communities.
why is it a game changer? Why is the vaccine being a game changer? Because, you know, people can still get, one of the questions that people were asking, we can still get COVID even though we've had the vaccine. So why is it a game changer?
So here's the thing. With the vaccine, there are a number of things that were unknowns. We weren't sure, for example, what effect would that have on transmissibility? You know, would you be able to still pass it on? The data that's coming in now in terms of its efficacy, so how many people will end up in hospital or be sick or whatever, has shown a dramatic reduction in relation to that. I've got a graph that I roll out every now and again, which just shows the over 80s at the beginning, and you just see it. It doesn't drop at 45 degrees. It just falls completely.
So basically,
it just disappears, and cases suddenly become zero. I've got over 60s, some weeks where I have got 0 cases.
Yeah. So basically, the vaccine works almost to 100% effect, and at the same time, it reduces the fact of you passing it on. So you can still get COVID, but it will be very, very mild. Is that what you're saying?
That's right. So your risk is your risk is lowered considerably, but also, if you are unfortunate, it mitigates any the symptoms that you would get. It's a complete changer, and I know Dr. Mohammed will say, he has seen that in his wards. He's noticed that the demographic has changed, the age group has changed. Even those that are getting it are not the people that he was treating, the end of last year. So it is incredibly effective.
Dr. Tufail, have you noticed the difference in the hospitals? The numbers of patients gone down dramatically?
Oh, absolutely. I just wanted to make 2 points. As Ivan is mentioning, that in the first wave, we saw many elderly patients being admitted with COVID. And in this second wave in January, February, it was mainly younger population which was admitted. So definitely vaccine has worked, no doubt about that.
So one of the questions, Dr. Tufail, that's coming in is young people are saying, it's not going to affect me, why do I need the vaccine? But obviously they do, because they're ending up in your hospital, are they?
Absolutely, and that is our fear, and that if any time a third wave comes, it will be the people who have not been vaccinated. Those are the people who will be coming to hospitals. I'm afraid. I'm very sorry to say that.
So if somebody's in their 20s or 30s, you'd advise them to be vaccinated. Is that what you're saying?
Oh, absolutely. Vaccines are safe, and they must be vaccinated. Though age is a big predictive factor for prognosis and everything, but we have seen young patients coming to the hospital unwell, especially from our community, from ethnic communities. So definitely, I will advise them to have vaccination.
Thank you, Dr. Tufail. I just wanted to bring Dr. Latif in, Samuel Latif. Do you feel the messages are getting out there, and is there
yes. Yes, so sorry, I had my hand up precisely just to reiterate what Ivan and Dr. Tufail have said about how important it is to get the vaccine, to get the jab. Leicester has a relatively younger population if you look at the demography. So our elderly population has by now the majority by far and large have received both doses of the vaccine. However, as a younger population, we all need the vaccine. So when you get your invite for the vaccine, please come forward and receive your jab. If you have any concerns, talk to a trusted health professional. It could be your GP, it could be a nurse, it could be a trusted community champion. It is only natural that people will have questions, but there are lots and lots of sources where you can get answers. And I must commend Ivan's team in Leicester. We have seen the rollout of the vaccine arranged in such a way that during Ramadan, there are clinics that are offering it after you break your fast. Community champions are working in the mosques, in the gurdwaras, in the temples, in all community centres. So well done, Ivan. I mean, it's been phenomenal what you've managed to do in Leicester, but it's exceedingly important, Zuffar, that the young population do get vaccinated. You need both doses of the vaccine. One dose will not offer you the protection that both doses of her. So please come forward. And if you have any concerns, I mean, I know there have been lots of talks and discussions around any myth busting or any concerns you have, please talk to a trusted health professional.
Thank you, Dr. Latif. One of the sort of myths that are coming in were, it's going to change your DNA, it's going to track you, they're installing a tracker in you, and the other one was, it's going to affect your fertility. How true are these?
So Zuffar, I think the name the vaccine is called one of a couple of the vaccines are messenger RNA vaccines, and by people reading the name messenger, they think that there's a message that's going to be put into our body. They think it's going to tinker with or tweak our DNA. The actual mechanism of the vaccine is such that once it's in the body, the component, the messenger RNA bit, is deactivated within hours. So it will not track you. It is only in the vaccine there to be able to give us a bit of that protein of the virus so that our body can recognize that foreign body and mount an immune response. So it does not track you. Regarding the fertility, there is no evidence whatsoever that it affects fertility of females. Zuffar, I think historically, if we look at vaccines across the world, people have concerns because of historical reasons or lack of information. So the most important thing we can do, I think, is provide the information in a culturally intelligent way, in a language that people understand, so that they're aware of what it is and their concerns can be addressed. But both the myths or concerns that you have raised, Zuffar, if listeners are asking about them, it's absolutely safe on both those fronts. Both those fronts,
yeah. And actually, you can be tracked more by your mobile phone than you can by anything else. Anyhow.
Oh, definitely.
I remember reading an article somewhere fairly recently, and they said the two biggest things to save humanity is clean drinking water and vaccines. So it is on that level as clean drinking water, will save somebody's life the same way the vaccines are. Ivan, the NHS locally has been really reaching out, these out-of-hour clinics, these pop-up clinics, these walk-in clinics. They've been running every clinic under the sun to try and get people vaccinated, and it is working. Can you send our congratulations to the NHS CCG teams and everybody else who's working so hard on delivering the vaccines to the public? And that outreach must carry on to make sure that we get 100% coverage.
Yeah, I absolutely will. And as you will know, Zuffar, we all try to work together, but I have never seen us all pull together to the same extent as we have around this. We are absolutely, you cannot put today is a prime example. You've got public health in the local authority, public health in PHE, a secondary care clinician, and we all get on and we all know that we can pick up the phone and talk to each other in order to get what we need to. We will all be on if I call for a conversation or a webinar, there was a time that I'd have to think, who do I call? Now I've just got a list of people who say, yeah, I will do it. I'll do it tonight. It's a very, very different feeling. And I think that is a way of working that we want to just keep going as we go into the future.
It's fantastic.
Could I put an comments there, Ivan? I think what COVID has taught us is we can't leave anyone behind. We can't leave a ward, a district, a city, a county, or even a country. We can't leave anyone behind. COVID affects everyone, and if we want to come out of this, we've got to work together.
You just have to look at the scenes in countries like India and across the world and realise actually that we all need to play a part and all need to look wider beyond our shores and think about everybody across the world now. Before, we might have been thinking about Great Britain or Europe, but now it's across the world, and really that sends a message home. We're going to be going to a break shortly. I'm just going to remind the viewers of our telephone numbers. Our text number is 077 488 55055, or our phone number to call in is 0116 482 2086. You're listening to Radio Ramadan on 87.9 FM. We'll be talking about drugs and these silver gas canisters, laughing gas canisters, after the break. And we'll be looking into why they're damaging, what we can do about them, and what the truth is behind these things. So please join us after the break. You're listening to Radio Ramadan on 87.9 FM. Assalamu alaikum, brothers and sisters. You're listening to Radio Ramadan on 87.9 FM. I'm your host this evening. We're doing the NHS show. My name is Zuffar, and we've got some esteemed guests with us, all working extremely hard for our NHS and been making sure that everybody stays safe and sound over the last 12 months. Our text number is 077 488 55055. Or our phone line number is 0116 4822 We're talking about drugs. Have you seen people dealing drugs in the streets? Have you smelt drugs as you're walking down some of these streets in Leicester? And how, are we dealing with this drug problem, as well as these laughing gas canisters, these silver little canisters that you might see strewn across our streets, across the city as well? And are you a shisha smoker? We've got the expert here, Dr. Muhammad Tufail, who'll be talking about shisha and the use of shisha as well. So first of all, I want to bring in Sumaya Ibrahim, who's a community recovery worker. You've been listening to our conversation about COVID. You wanted to make some comments on that.
Yes. In terms of COVID, what we have seen, first of all, I work for Turning Point. So what we have seen is a rise in referrals. Often, because people are so isolated,
because they're isolated, they've turned into drugs. Is that what you're saying?
No, not necessarily. But for some people who do have tendency to use something as a coping mechanism, whether it be alcohol or cannabis or anything like that, what we have seen is their use has increased. Because obviously feeling so isolated from the community, from their loved ones, boredom kicks in and, you see a rise. I'm not saying COVID is the reason why people are using drugs now.
No, okay. And Ivan Browne, Professor Ivan Browne, what have you seen an increase in drug use, and what problems does it cause us in the city?
I think that as Samir was saying, the challenges that we face are that people will self-medicate when they are in pain or hurting or whatever. So it's we walk into our city centres. We can often see people who have used drugs or are using drugs. But I think the challenge and the worry we have as a service, as a commissioners of the service, are making sure that people who are making choices, thinking about choices, particularly those that don't want to be in that position, that we are making sure that they can access those services, that they don't feel trapped, they don't feel ashamed, they don't feel any of those things. Because if you look across the country, if you look across the world, actually, drug use is a scourge that we are all trying to battle with, but actually this actually comes down to, as I've said before, individuals, it's down to families, it's down to communities, and that's the only way that we're going to tackle it. Legislation helps, of course it does, putting services in place helps, but actually one of the big things is about our community structures and the way that we advise each other, support each other, question each other, as you said, making sure that we keep focused and be open about the challenges that we face in relation to drugs within our communities. And me certainly coming from a West Indian community, we know about this, we know about the challenges and how it can affect families and communities and destroy, strong bonds that you've had in the past.
Dr. Sami Latif, we've seen lots of drugs use happening in Leicester. It's a growing problem. Lots of Asian children involved. Drugs are haram in Islam, and they have a real detrimental effect on our community lives, doesn't it?
Was that a question for myself?
Yes, that's right, yes.
Yes. No. Yes, certainly. And I think what our youth probably need to understand is they are living in the moment, and they think, oh, we'll just try it once or have it now, and then we're going to leave it. Drugs can be very addictive. And as Ivan has said, and as Sabat has said as well, about they can actually destroy whole families and communities. The whole infrastructure can be destroyed because it's a habit that's very hard to get out of. So I think the key thing to youngsters is do not be tempted, do not try it. And if you see your friends or your colleagues doing it, talk to a responsible adult who can help them. I can only speak anecdotally, but in Leicester, I have seen an increase when you're walking the streets in some of the areas. You can actually smell whiffs of it, and you can see sometimes, I think what I've seen is drug dealing on the streets. I've not been brave enough to counter it, but I think that's what I've seen. So it's becoming a bit more open and visible now, much more than it was a few years ago.
Yeah. And let's be clear, drug taking is haram. The lots of young people do it because they think they're making money, and the parents seem to turn a blind eye thinking, well, my children are bringing money. That's totally wrong and against Islam, isn't it?
It is, and you as a responsible parent should be questioning if you think that there are unnecessary amounts of money being asked for, where is it being spent? Just sort of be a bit more vigilant so that you know what's happening. There is so much pressure on social media, so much peer pressure nowadays. It's very hard for children to know what's right, to know what's wrong, and not to be sucked into that. And I think Islamically, we know that in the month of Ramadan, people who smoke give it up for the month of Ramadan. So it is doable if you have started this habit. There are many places that you can be signposted to where you will receive help and you can give up this habit.
Excellent, thank you. We just got a question coming in. I'm going to go to Samay afterwards, but let me just ask the question. Salam, if you saw the queues at Melbourne Health Centre today, there was Pfizer vaccine available, you would think that there was no vaccine hesitancy. The problem seems to be more to do with the brand rather than the vaccine hesitancy. So is there opportunity to get more Pfizer and Moderna and some of the other vaccine brands into Leicester to help the vaccine hesitancy, Ivan?
So this is a challenge. It's been really interesting watching this. So first of all, I remember when vaccine was first coming online, that lots of people said, I'm going to wait for the AstraZeneca because I know that, and I know that's produced, it's not an RNA vaccine, it's produced the way that vaccines are normally produced. But clearly, some of the conversations that had been held around issues such as, the issues around hemorrhaging, etc., and also some of the conversations about efficacy have kind of moved people's thinking in relation to Pfizer. Now, I can absolutely understand where people are coming from, and it's very difficult to filter news that comes through. But what I will always say to people ask me, which vaccine should I take? And my response is always the same, which is to take the first vaccine that you are offered, because the risks that are associated with the vaccine, whichever one you are offered, compared to the risk of COVID. I mean, if you think about, the risk of hemorrhaging as a result of having COVID, it's thousands of times greater than any vaccine that's out there. And sometimes we are looking at little margins between vaccines rather than thinking that what we're trying to do is reduce the risk of COVID. And that's the one that's going to kill you. That's the one that's going to give you long COVID. That's the one that's going to put you into hospital.
So the message is quite clear that take the first vaccine you're offered. The vaccine, is the safest option. It will save your life. It will save the life of your family because it's the vaccine. And actually the brand is a secondary point really rather than the primary point. Okay. The question about drugs, Samaya, I just wanted to bring you deal with lots of people who have these drug issues. How can we deal with this really serious problem?
I think I'd like to follow on from what Ivan said. In order for us to tackle and support people on their recovery journeys, it's important that we have the support of families, communities. Once a person is really motivated and is engaging in drug treatment and drug services, what we also need and what we also realize in Asian community and people us as culture, we need each other. We rely on our extended families and siblings and parents and communities. So it's really important that the community comes on board and also takes some responsibility as well, because a lot of these people, when they have been through a recovery journey, and they're coming back to their families or their communities, often communities tend to have this way of shunning people. Oh, he's a drug user. Oh, let's not trust him. Well, how do you expect the person to feel rehabilitated? So I think a greater awareness needs to go out there. I also wanted to follow up on that point that Sister Samia made. I think, when you asked the question about parents and kids bringing money in and everything, I think as a parent, I'm a parent too, I would have to ask my children, why have you got them set of trainers? Where did they come from? Especially if you're not working, or I'm not giving you enough pocket money. So these are the kind of things that parents need to ask. Now, we as a service, we have family workers, we have recovery workers, we're happy, we're saying, come, we want to work with communities. We also don't mind working in community centres, obviously given that we've had COVID now, but also I know my colleagues, they're constantly ringing people up at home, checking on them, making sure that they're all right, on a regular basis. So that's the kind of support we're offering. But myself and my colleague Dilesh, we're both community workers, and what we want to do is lots of community awareness around substance misuse.
Yeah, so the whole point about, some Asian parents turning a blind eye to their children being dealers and earning thousands of pounds, bringing into the house and using that money, that should stop. That is creating the people to do this business and actually is blighting our communities. And
not only that, it's illegal because you're complacent in that.
And it's haram, I'm pretty sure, as well. Yeah. So, there's a whole catalogue of things. There's no point keeping your fast if you're going to be selling drugs. It just doesn't work, does it?
No. But it's not just that. It's not just that. That's one of the reasons that you're saying that. But there is also other reasons as well. Parents trying to keep a lid on this. So if one of your family members is using drugs or alcohol, shame is a really massive thing in our communities, and I've worked with parents and in the community where to deflect the blame from themselves or whatever, because parent tend to blame themselves when their children do something wrong, and that's something natural, but they question themselves. So what tends to happen is we're using jinns. He's been possessed. These are the kind of things that we're coming up against when we're trying to tackle it.
Thank you, Samaya. We talk about now the gas canisters. I don't know whether everybody's seen them. The small little silver canisters that are strewn in different locations. I've saw them on some of the streets across near Evington Road, but they're in Oadby in different areas of the city across the board. Ivan, is this a major problem, and what problems can that cause for people who use them? Ivan?
Thank you. Yes. So I think there are a couple of aspects that I want to pick up from that. So first of all, this laughing gas or hippie crack or whatever.
Some people say it's just a social sort of gathering kind of thing, but it's more serious than that, isn't it?
But it's not exactly. It's more invidious, and that's the thing that we've got to be really aware of. So somebody said, "Oh, it's just this. It's just a little bit of laughing gas." Well, actually, clinically there is an issue because obviously the issue is that when you're taking in when the risk is you're not getting enough oxygen when you take this little balloon of laughing gas. So clinically you are putting yourself at risk. But secondly, I think the other thing is that Samaya will tell you about this. It is the introduction That's the scary bit. So you do this and you think, oh, it just give me a real hit. It gave me a real buzz. I felt really great about it. I've got all of this under control. You do that for a while, and then before you know it, you need more. You need something a bit harder to give you that same feeling that you had before. You don't start off at the hard end of this, and you actually introduce yourself over time to try to chase the feeling that you had from that introductory drug.
So you actually lose the feeling as time goes on. And
Absolutely.
then you go to the next level, which is cannabis, and then you go to heroin or whatever else it might be in a chain. And before you know it, you're on a massive downward spiral. Wow.
Yeah, that's it. And I think that it's going back to the point that we raised about community, because how do you stop that? We've got to recognise that we are in a battle here. And I think that Samia spoke about this. If you are anything like when I grew up in my community, and I know it's exactly the same, our conversation about drugs was very short. It was don't, right? That was it. Now, there was no exploration of that. There was no querying around that. And then we've got to realize our children are seeing things that say, well, if you do this, it'll make you feel great. Or if you're in the business, you'll get money, all of those kind of things. We need to have very, very serious conversations with our children, with our nieces, with our nephews about, okay, not at all cost. There are alternatives. There was an idea that to be successful was not about money. It was about you developing. And I think we need to get back to that narrative. I think we need to be honest about what's happening in communities when we start seeing things in social media and saying that is not for us. That is not something we want to follow. So I think there are things in terms of policing our own communities which are fundamental to meeting this challenge also.
That's the most important point, and that's the big message. We need to be looking out for ourselves, for our community and the wider community dealing with these issues. Dr. Tufail, we're running out of time, but if you can quickly come in on this gas canisters, as well as the clinical shisha, reason for shisha. We don't have much time, but please, if you can come in on these two issues, that'd be great.
Absolutely. Thank you, Zuffar. So as far as nitrous oxide is concerned, it's a very bad gas, really. It is absorbed into your blood, through your lungs, and goes to your brain within seconds. And it displaces oxygen from your body. It can even asphyxiate people. It can produce lack of oxygen in your body, and it can be lethal even. So though people feel euphoric and excited after this, but then it's a dependency on it, psychological problem.
Damage your lungs and your body?
Absolutely. And one point I want to make is that 70% of this nitrous oxide abuse is in the age group 16 to 24 years. And as you know, the brain is still in the developing phase in this age, up to the age of 25. And you can imagine that this nitrous oxide gets absorbed into your blood, goes to your brain, and damages your brain.
Yeah. We've only got a couple of minutes left, less than a minute. Shisha, how damaging is that, or is that very similar?
Absolutely. I think shisha, there's a misconception that shisha is less harmful than smoking. It's not. Actually, if you see that, if you look at the studies, that average time of shisha smoking is about 1 hour. And in 1 hour, if you smoke shisha, it is equal to smoking about 100 cigarettes.
Wow.
And,
so it's just the same damaging as 100 cigarettes in an hour?
Absolutely, in an hour. And usually you will not smoke 100 cigarettes in an hour, but through shisha, you do have that effect. And shisha smoking has the same bad effect as cigarette smoking, which includes decreased capacity of your lungs, chronic respiratory problems, mouth cancer, stomach cancer, and lung cancer. And being a lung specialist, really, I don't want anyone to have lung cancer. These are lethal cancers.
We're just running out of time, Dr. Tufail. So I just wanted to say thank you very much for our guests. Really appreciate all of you coming on. Sadly, we're just running out of time. You're listening to Radio Ramadan on 87.9 FM. I hope everybody enjoyed this conversation and listened and learnt a lot of what's going on in Leicester and Leicestershire. Thank you very much for all our guests and really appreciate you coming on. Assalamu alaikum.